right, so hello everyone and welcome to the Babies in Common videocast and podcast. I'm Jeanette Massey from, that's Melissa, and we have Justine here with us. We'll introduce her in a moment. I'm the owner of Babies in Common, and I'm an internationally board certified lactation consultant, childbirth educator, mostly retired birth doula, and mother of 2 teenagers.
And I am Melissa Ann Dubois. I am a labor and delivery postpartum nurse of 13 years. I've worked in all sorts of hospital and outpatient settings. I'm a childbirth educator and a certified lactation counselor. I'm also the mom of 3 young children, and I'm currently providing home care VNA visits for clients who have had home births and doing some birth doula work for people who are having hospital births in the time of COVID-19. So that's me. We have another great episode for you guys today, but before we get started, just a reminder that, as always, anything that Jeanette or I or our guests say during this conversation is not to be taken as medical advice. Please consult your own qualified healthcare professional for questions about you or your baby's health. Also, the opinions expressed during this conversation are personal to the hosts, guests, and any participants, and do not ever represent the views or policy of any current or former employer, including hospitals and clinicians. Our conversations are conducted on a HIPAA-compliant platform, and for a full review of our disclaimer, please visit babiesincommon.com/disclaimer.
Thank you. All right, so today's May 25th, 2020, still in the midst of the pandemic, although some things are starting to open up. And today we're going to be talking with Justine Leach about what makes a good birth for you and how to choose a childbirth class to help you get there. Justine is a childbirth educator and advocate for trauma-informed care. She left academia after getting her PhD to co-found Resilient Birth after the birth of her 2 children made her realize the impact of past experiences on childbirth and the importance of attending to the emotional journey of parenthood. And she believes that wherever and however you choose to give birth, it's important to feel seen, heard, and in control of the decisions you make about your care. And we couldn't agree more. So thank you, Justine, for joining us today.
Thank you for inviting me.
Awesome. So as a first question to get us going, so you work as a birth advocate and childbirth educator, and you also do professional trainings as well. What inspired you to do what you do?
Well, as you mentioned in that introduction, the birth of my 2 children really took my life in a completely different direction than I expected. When I was pregnant with my first, I was doing my PhD, and I honestly thought that that was going to be my trajectory in life. I was going to become an academic, and I had a really difficult time in that first birth. I am a survivor of trauma. And so a lot of things from my past came up for me during that birth. And, you know, I got through it. I spent the months postpartum kind of recovering from that. And then sort of fast forward a couple of years and I'm pregnant with my second, and I'm suddenly incredibly anxious and very, very afraid of giving birth all over again. And so really needed to seek out a lot of emotional support. And I was extremely fortunate to have a wonderful doula who kind of guided me through that prenatal time when I was struggling so much with so much anxiety. I had a wonderful second birth and graduated from my PhD actually 6 weeks later. And then I was in this sort of kind of between time. I had a new baby, and I had the opportunity to speak at a local conference on my experience of giving birth as a survivor. And through that experience of sharing my story, I actually came to realize that I could have an impact far greater in this world than in the world that I was in, and that people really need emotional support in this time, and they need help. If you are having a lot of anxiety, or if you do have a history of trauma, then I realized that I could develop a system and an education program, a childbirth education class that could really help you. And so, and in addition to that, I could help providers, medical professionals, and other birth professionals really understand the needs of survivors giving birth. And so that's kind of how I got into training as a childbirth educator, developing my own childbirth education curriculum, and training providers to be more trauma informed in their care.
Awesome. It sounds like a rocky road to get you where you are, but sometimes that's the best way to start, you know?
Mm-hmm.
That's true. So, Justine, your business name is Resilient Birth. Why did you pick the name Resilient, and what does that word mean to you relating to preparing?
Well, so here's the thing. I thought very hard about what to name the company. And I was looking for a word that tapped into the strength that birth givers have. So, when we think about someone who maybe has a lot of anxiety around giving birth, or who has a history of trauma, sometimes, people can take the position of, oh, poor you, and really not understand how much power and how much strength that person has. And so what I was looking for was a word that really captured how birth givers are really strong. And if you are pregnant and are preparing for birth, you have a life history that has given you the skills and the tools to get through this experience in a way that is safe, in a way that where you can feel your strength. And so I really wanted a word that kind of taps into the power of the birth giver. And that is, I think, a really important place for all of us who support pregnant people to really kind of believe in our core when we are working with clients, that this person is amazing, right? This person is powerful. This person who is sitting across from us and now is across from us on the computer screen, if we're doing work with clients through Zoom, that they really have resilience, and that they can get through hard things. They can get through hard things and experience joy. They can get through complicated things that are both wonderful and challenging at the same time, using the resilience that they already have.
That's a good
I
point.
love that. I've shared on this podcast before, but I have a history of severe obsessive compulsive disorder that was flared in a big way after the birth of my first child. I didn't even get a proper diagnosis of something I suffered for many years until I was 30. But my therapist is awesome, and she always says, it's like her mantra, you are a capable, competent, resilient person, right? And sometimes I like say that to myself in my head, like, you are a capable, competent, resilient person. You're going to get through this, whatever small anxiety or big anxiety you're having. The word resilient, and you can do hard things, because labor is hard work. If it was easy, they'd call it picnic, but it's not a picnic in my experience. But it was hard, but it was one of the best things I've ever done. Hardest things, but best things I've ever done. So I love that. Thank you for sharing that.
Yeah, and I think that message of you can do hard things is just so important and so powerful. One of the questions that I ask my clients is, when you think of a challenge or a time of difficulty that you have overcome, what gave you the strength to, get through that time? And very often people are like, oh, I don't really know. Like, I don't know what gave me the power. And then they'll say something like, I guess I could just do hard things. And then I'm like, yeah, you can do hard things. Like, let's put that into your plan for birth, right? That message to yourself is just so powerful, especially when it comes from a knowledge of something that you have previously experienced. And you're like, oh yeah, I'm standing here today because I can do hard things.
Mm-hmm.
It's really powerful.
I think what's also interesting is I ask that question sometimes, or you have conversations with people who are expecting a baby, and and they might say like, well, I don't think anything. I mean, I've kind of had it easy. I've never run a marathon. Like, I don't even exercise. So I don't know. I don't really know. And you can try to go back to like, well, did you go to college? Was that hard? Like, sometimes it's like, I feel like you're digging for like the hard thing they might have done. And also kind of going, okay, well, maybe that's not what they don't identify in their life something that was hard, but that just knowing that as a human, since the dawn of time, people have given birth, and that there's something resilient and strong about a human to be able to do this thing and to get through that, whether you're handed a difficult labor or hard decisions to make during that, or an easy, relatively quick labor. It's becoming a parent is a huge transition in and of itself. And what I feel like you add to that, and others, and it just is finding um it, the right way to discover within yourself what that strength is, so you can feel ready for that birth without that anxiety. So it's really good. Yeah.
Right, and as you say, that question may not resonate with some birth givers, and that's totally fine. Like, one of the really important things whenever we're supporting expectant parents is just meeting them where they're at. If they're like, you know what, I'm just not somebody who's really kind of had to overcome challenges, then that's wonderful. And there will be other questions and other ways of thinking about what you need in your birth to have a good birth experience, like to have a good birth, right? Like there'll be other ways that we can kind of think about what you might want to do ahead of time to help you prepare. So, another question that I ask is often about people's internal voice. So we often have a very critical internal voice. Many of us have a critical internal voice. And so I'll ask my class participants, so, when you think of your internal voice, what part of that voice would you like to quieten down during your birth? And what part of that voice would you like to get louder during your birth? And maybe that question is the question that somebody responds to, and they're like, oh, I would like this really kind of harsh, critical side of me that thinks I'm always failing to just get a little bit quieter during my birth. And I want to pull out the side of me that actually feels pretty confident in my ability to make good decisions. And that's, I always make good decisions. So that's the part that I want to kind of nurture and hear more loudly in this experience.
Yeah, that's a good point. I love that. So when you say a good birth, how do you define that? Because I know, as when I was a birth doula, especially a very active, I had to really like work to change how I looked at things, because what my thought of a good birth is, I didn't want to project that on someone else, right? And when you hear birth stories, and I've been hosting birth circles for years, you hear birth stories, and I have to, you have to stop and say, okay, that's her experience. I may not feel the same way about if that were to happen to me, but that's how she expressed that. And it's just been really interesting. But when you're saying like a good birth, how do you describe that so that someone can figure out what they want for their good birth?
Right. So you raise a really important point that like we all have our own individual preferences for birth. We have our own biases about what we think will make an easier birth, a birth that is healthier, a birth that potentially will make the transition to parenthood more straightforward. And so, one of the things that we as professionals have to do is really check our own biases, because the birth that I wanted for my children is not the ideal birth for other people. And so the definition of a good birth can't possibly be any particular kind of birth, right? So a good birth is not a vaginal birth, and a good birth is not a cesarean birth. A good birth is not how you give birth, whether it's medicated or unmedicated, whether you needed a lot of intervention, or you did it at home with very, very low intervention, right? So what constitutes a good birth for me is how you feel when you give birth, right? It is the experience that you have of your birth. And so when people feel seen, that means that you're feeling understood, that, let's say something, a decision needs to be made that you don't want to have to make, right? Like this choice that is presented to you is not a choice that you would choose. And your feelings are there around that, right? You're feeling disappointed or sad. If the people who are surrounding you are seeing you in that experience, that matters, right? Because a bad birth is one in which we feel alone. It's one in which we feel isolated. We feel as if nobody understands us. If we're feeling heard, that's a good birth. So to feel heard, we need to have a voice, right? And very often that means that we need help to have that voice, to elevate that voice, to have that voice facilitated. It can be hard to find our voice during labor. And so it's the responsibility of your care provider, of your healthcare team, of your support people to really work with you to make sure that you're being heard. Because a bad birth is one in which we feel as if we don't have a voice, in which nothing we say matters, in which nobody is actually listening to us. And then we also need to feel in control of the decisions that we make about our care. And that doesn't mean that we're controlling birth or that we have to be, like there's a stereotype sometimes of birth givers as people who need to control everything, and they want to have like this and that, and then they'll have a good birth because they're controlling everything that is happening. And that's not what I mean, because we can't control sometimes what happens in birth, and sometimes labor just is hard, and sometimes decisions have to be made that we and choices are presented to us that really we would rather not have to make those choices around, right? And so it's not that we're controlling how birth is happening. It's that we're in control of the decisions that we make around our care. So we have time to make a decision. We feel ownership of those decisions. We're not on a train that is just racing down the tracks without a driver, and we're a passenger that has no control over how this train is moving and where it is going. No, like we need to feel like, what, I don't like that, maybe I'm having to, if I was, say, planning a home birth, I don't like that maybe I'm having to consider whether or not right now I should transfer to the hospital, right? But if I make the decision to transfer to the hospital, that is my decision. That decision belongs to me, and I'm making that decision for good reasons. And I'm making that decision, in knowing what I know now. And I can come out of this experience thinking, yeah, that was hard. But wow, did I do well in that experience? Wow, did I make good choices, right? I was understood. I was able to voice my thoughts, and I was able to make choices that were right for me, right? And so for me, these are the things that really matter, right? So how to have a good birth, it's how do you feel seen? How do you feel heard? And how do you feel in control of the decisions that are made around your care?
And I feel like so many people are not asked that question while they're pregnant. Absolutely. So.
And I also feel like too many people, it's pretty well known in the childbirth ed community that, attendees to childbirth education, traditional in-person childbirth education, or even a live Zoom in the time of a pandemic, is on the decline. And, I feel like I want to take a megaphone and shout at a mountaintop, like, you don't have an option to be part of the decisions if you don't know what decisions you have to make, and education. I grew up with Schoolhouse Rock. I'm sure both of you are familiar. I'm dating myself for some of the listeners,
I don't
but
know,
knowledge is power.
did they have that in
And
England,
so,
Justine?
No, I have no idea what you're talking about.
Oh, man. That's right. You're not American. Well, it was from the 70s, and it was these cartoons that were on Saturday morning about like history and grammar and science and math, and they were little jingles to remember things. So the tagline was "Knowledge is power," and I believe that. So it's important to, because if you don't know the options, then you don't have any. If you don't know that a decision can be made, then you don't know that you can be part of the decision. So childbirth ed is so very important and still so very alive and well in, all over the world. So um, now, I wanted to back up just for a minute, Justine, and I know you mentioned that you left academia. You have a doctoral degree, I understand. And can you talk a little bit about what you studied and what your thesis was about, and if that at all applies or enriches your current practice as the trauma-informed childbirth?
Sure. So my PhD was in representations of sexual consent in narratives of sexual violence. And so it really focused on both kind of cultural representations of sexual violence, legal representations, so the law, and then also kind of more kind of philosophical aspects of this whole topic. And so I read a lot and wrote a lot about trauma. And as I mentioned earlier, I'm also a survivor, and part of the PhD, so whenever we write a PhD, even if we're writing in the sciences, we're really working on something personal as well as professional. And so that was certainly the case for me. And I loved my PhD. I really did. I really thought that I can see the value in thinking around how do we understand consent? How as a culture are we understanding consent? And why is it so hard for people who have experienced sexual violence to have their stories believed, to share their stories? Why is it so hard to get a conviction for rape and other sexual assaults? So when I transitioned to working as a childbirth educator and then also supporting survivors who are giving birth in a sort of one-on-one capacity, I really do use that PhD. It kind of forms, it forms the sort of bedrock, as it were, of my knowledge of trauma and of the ways in which our previous experiences in our life can come up for us at other times. And so you might not call something that you experienced a trauma, and that's totally fine. Like, we don't have to label it as a trauma. But as human beings, we do we'll constantly have the kind of past evoked for us, right? So maybe you've had this experience where you walk down the road and then there's a particular smell, and something from your past is brought into your kind of present, and you're like, oh gosh, I kind of almost can feel it, that sensation that I had in my body when I was way back when I was 15 years old and I was doing X, or this happened, right? And so particularly when we are going through a major life transition and things can feel very big and very intense, and we're also experiencing a lot of deep emotions and deep physical sensations, as well as interactions with healthcare providers and potentially invasive procedures, all of this sets up the possibility for things from our past to come up for us. And so I'm extremely grateful for that PhD and for that work, because it really does help me understand how that happens for people. And then the other thing that I would say it also does is, because it was so targeted on sexual consent, consent is incredibly important for me, and it's important for me in terms of helping to educate my clients around how they can use their right to informed consent and refusal, but also in terms of how I practice myself with them. So within my childbirth classes, it's really important for me that I am creating the opportunities for people to say no to me, and that that's okay, right? And that that won't be punished. And I keep, I really do try very hard to facilitate other people's consent as an experience within the class itself.
That's very true. I notice in teaching over the years that many people come into a class and they're taking a class because they're supposed to, and they heard they were supposed to. They don't really know what they're getting into a lot of the time, or maybe their friend told them that that was a good idea, you know. But then when you start talking about consent, it brings up issues where they're like, what do you mean consent? Of course they're going to ask me if it's okay. But when we work in birth, we know that that doesn't happen all the time. And people think, well, if I'm going to if I'm going to be having a birth, whatever they're going to tell me that they need to do to me or to my baby, that of course is going to be necessary. And we know that that's not the case either. So it's also setting the bedrock, as you called it, of knowing what the realities are in the environment that you're about to go to, you know. And I say that in a way because I know that, you know, in home birth there tends to be more consent than in a hospital setting, but it always is dependent on who's with you in that moment. And not every person birthing knows who their care providers are going to be and the way that they're going to be spoken to. And I love that you do all the work you do with professionals, because the more people that can hear this over and over and over again, they can be more careful about how they present themselves, or even just help create an environment. I know one birth I attended, the mom was very clear ahead of time that she did not want any men in the room except her husband. And there was this anesthesiologist that just kept coming in, and I finally had to stop him at the door and say, like, really clearly, like, I don't know what you've missed, but she's very clearly said that you cannot come in until we say it's okay. And then you can step foot in the room, but you have to stay very far away, announce who you are. So until you're ready to do that, you can't come in again, you know? And if I weren't there, I don't know who would have done that, because actually in that moment, her husband wasn't even in the room yet because he was doing something else. So it's just like, you think about these situations as a doula that I've seen, or, you know, Melissa, as a nurse, you've experienced as well. And, you know, I know you're very protective of your patients in hospital settings, but not everybody is. And so it's so key to also highlight to people who are getting ready to give birth that they have to figure out, okay, what might happen to me, and why I might actually have this experience, and how do you navigate the health system to put yourself in a place with care providers that automatically are going to provide that kind of care, that they just act in a way that, of course, we're going to make sure we get your consent before we do this. And that's why people should take childbirth classes. But there's also
100%. I agree. I was going to say, I have close to 10 years as an inpatient labor and delivery nurse. And I know it's hard to hear. And sometimes as childbirth educators, people get angry at the messenger. But it is very true that there is a astonishing lack of consent in inpatient, modern, interventionist maternity care hospital settings in this country. And it is the first time for many of my clients, my patients that are taking my class, that they have heard that they can say yes or no to things, or that people might do things without their consent. For example, something that comes up a lot is when we talk about episiotomy, and there's always a person who raises their hand and says, well, they would ask me before they did that, right? And I have to be the one that says no. In my experience, there are many providers I have worked with who do not ask consent before performing an episiotomy. So here are ways that you can advocate for yourself if that's not something that you want, unless it's for the health of the baby in distress in a true emergency. And they often kind of get mad at me, like, why is that true? That's not fair. That's not the way it should be. And I'm like, you're kind of preaching to the choir here. That's why I do what I do, right? But, you know, part of taking childbirth education is not only learning what you can learn in a book, right? It's not just like, oh, well, I can learn all that in a book or on babycenter.com or whatnot. I mean, yeah, lots of the factual stuff you could read in a book, but it's the most important things are about you can give consent, what things you can give consent on, how to advocate for yourself or your partner or for the good birth that you want. That's also part of childbirth education classes. So
Right.
I agree.
Yeah, and even like taking that a step further, like working out. So one of the things that I try to help my participants do is work out where they lie on the spectrum of being somebody who tends more towards sort of submission when they're faced with a recommendation or suggestion from a provider, or somebody who feels much more powerful in their sort of capacity to advocate, right? And so for some people, and this can go back to a history of trauma where it is just safer to submit, right? So if you have had that experience growing up where it has been safer to submit, then that can be your go-to. Right. And so even just then, the capacity to advocate for yourself can be incredibly challenging. And so one of the things to help people with that I think is so important in childbirth classes is working out like, okay, so, how far do you want to advocate and what help do you need to advocate, right? Maybe it's that you employ a doula, right? So that you have somebody who can say to the anesthesiologist who keeps on coming in the room, you know what, she said very clearly on her birth plan that she doesn't want you here. And so that actually that responsibility is not fully on the birth giver, because maybe that person can't find that voice in that moment in time. Maybe it's that you, so very often I suggest to my clients that the birth partner is, like, one of their roles is buying time. And so like that's one of their jobs, is to buy time. And so there's a suggestion like, we need to do a vaginal exam right now. And it's the partner's job to say pretty much immediately, that's great. Can we have 5 minutes to talk about it? Right? Can we have 5 minutes to talk about it? Just the two of us, right? And so that buying of time then enables somebody to have a conversation with their partner, which is often a more safe conversation to have, that then they can come to a decision around and then advocate for whatever that decision may be, right? And suddenly now, remember how I was talking about feeling in control of the decisions you're making around your care. So if the agreement is ahead of time that you are going to buy 5 minutes, right?
Which usually ends up being 30 minutes because they get busy. So that's
They don't want to stay in the room. Absolutely. That is a great technique.
Right. Like, yeah. So if that's the agreement ahead of time and your partner knows that that's their job, right, then you can have those conversations in a much safer way, come to a decision. Okay, yes, we're going to go ahead with this vaginal exam, or no, actually right now it's just not feeling like an okay time. And then articulate that to your provider, to your healthcare team. And suddenly it's like, okay, not like, oh, I was subjected to X number of vaginal exams, but rather, no, I chose to have X number of vaginal exams. And what a different feeling it is to be the one who's decided, actually, I would like to know where I'm at right now. So yeah, like, let's go ahead and do that.
Yeah, I use that expression all the time. Like, people will say after their birth, well, they had to do this and they had to do this and they had to do this. And I was like, again, I don't want to ruin their birth story. So it depends on the context. But sometimes I'll be like, well, prenatally, how about we talk about you owning those decisions so that afterwards you're not saying they told me I had to. But instead they're going, they gave me information and we chose to allow them to do that intervention. It's a very different, it's coming from a different place in your mind. Mm-hmm. And deep in your soul too, instead of feeling like the victim, they had to do it to me, you're feeling like, oh, they offered me a service and I said, yes, thank you, please do that.
Right. I completely agree. I was going to say that I encourage people all the time when they use that language of permission to reframe it. Like, well, they said I had to have an ultrasound, so I went to the hospital. I'm like, they offered an ultrasound and you agreed? Like, well, yeah. I'm like, no, say that. Like, even if it's subconscious, it makes you feel more in control, reminds you, yeah, this is something that, that I wanted, that I went to. I also want to mention, as a nurse who has worked in a patriarchal, highly interventive medical model of care for the last 14 years.
In multiple hospitals. So you're
In
not even
multiple
just speaking
hospitals,
from
yeah.
one hospital experience.
The technique you're describing, Justine, of the partner being the buyer of time, I think is far more effective than the partner who is no, she doesn't want that. Because whether or not, it is, I wish it weren't the case that people in the hospital don't react that well to that, because people should be able to advocate for themselves, whatever they want. They should be able to rip off their monitors if they want to. You know what I mean? I'm just saying, as far as having as less of a dramatic experience as possible, and really being able to be in your labor land. If somebody comes in and says, "Oh, I'm going to do a vaginal exam on you," and your partner says she doesn't want that, that's automatically going to create a hostile environment for you, and that's not something you should have to go through. Whereas if the partner said, like you said, "Oh, awesome, can we have 5 minutes to discuss that?" There's no hostility there. That buys you time. That absolutely accomplishes your goal. And as Jeanette has mentioned, they don't like to stand around. I've had providers leave for hours because I asked if they could just wait for the patient to go to the bathroom first before they do the vaginal exam, and they don't come back for 2 hours because they're so impatient. But so it really, it's not, sometimes people are like, well, I should be able to say, no, she doesn't want that. And you're right, but if you're thinking about a way to keep the environment calm and conducive to the laboring person, that is a very effective, not at all confrontational technique. So I agree 100%. So Justine, you and myself and Jeanette, we all teach independent prenatal and childbirth classes. I teach Through Babies in common with Jeanette. But I've also taught in 3 different hospitals as part of their official childbirth ed program. I know Jeanette has taught in 2 different hospitals. Justine, what do you find is the difference generally from hospital birth classes versus independent or community-based childbirth preparation classes?
So let me preface this by saying that I do know some really excellent hospital-based childbirth classes and some fantastic hospital-based childbirth educators. And so this does not apply across the board, but there is, so with an independent childbirth educator, you do have more independence. And so there is a greater likelihood of the information being passed to you as being less sort of down the hospital policy line, right? So childbirth classes in hospitals can be, here's kind of just the information that you need to get through this hospital birth system as smoothly as possible for us. And that's not the case for every single one. And I really want to emphasize that. So do your research, because as I said, there are some really fantastic hospital childbirth educators who, because of the environment that they work in, they do have the freedom to really give you all the information that you deserve. But some places have to kind of toe the hospital policy line. And that, I think, limits their capacity to really help educate you as fully as possible. The other thing I would say is that, and I don't know whether this is distinguishes between hospital and sort of out of hospital childbirth classes, but certainly it distinguishes between some childbirth classes and others, is to think about, like, what are they doing, right? Are they just giving me the information that I could receive from the internet, right? Because then I do wonder, right, what is the benefit to taking a childbirth class, right? If it is just, here's the stages of labor, this is the anatomy, right? And these are the potential interventions. If that's all you're getting, then yeah, you can read that up outside of a childbirth class. You can completely and utterly educate yourself on all of those things through Google. So then the question is, what are the really excellent childbirth classes doing that is more than that. And I would say that there is so much value in good childbirth education. So for me, good childbirth education means that you as a couple, right? So you and your birth support person who are attending hopefully together, you as a couple begin to talk about and learn what are your birth goals, right? What are your values? What really matters to you, right? So this is very different from what are the stages of labor. It's what matters to me. And maybe what matters to you is that is less about whether or not you have, say, you know, a very medicalized birth or a very unmedicalized birth, but about whether you feel really supported, right? And so then the question is, how do we get you to feel really supported in your birth, right? Or maybe it's that I need to feel safe. So how do we help you feel safe? A good childbirth class brings you closer together as a couple. A good childbirth class helps your partner learn how to be the best support person ever for you as an individual. Good childbirth classes gives time for you to explore your needs and your fears and your concerns and your questions, right? So that you can have those things answered, so that it is less frightening. Like, let's say that you are afraid of having a cesarean. A good childbirth class is going to help you feel better about the possibility that you might have a cesarean, right? And you can't get that from Googling information around cesareans, right? But you can get that from a good childbirth class, right? Where you suddenly think, okay, like I know that I want to feel powerful and an active participant in my birth, and that's why I'm afraid of a cesarean. So how can I feel powerful and a participant in a cesarean birth, right? Because if you can work that out, then you can have a good birth that's a cesarean. It might not be your first choice, but it doesn't mean that it's not a good birth, because you had the feeling, the experience of power and of participation. And that is the thing that is what you need to have your own good birth.
We actually just had a couple episodes of our Videocast podcast that were about that. So
yeah, I was just going to say the last episode 13, was about having a positive cesarean birth experience, even if that is not what you wanted or hoped for. So right on point. I agree 100%. Childbirth ed classes, I mean, I've had to shadow a lot of hospital-based childbirth educators as part of my training in childbirth education, but also I revamped 2 different hospitals' childbirth ed programs. Like I completely turned them around and flipped them inside out. So I've had to shadow what was already being done. And if the childbirth class that you took only explained to you what to expect as the general flow of things on labor and delivery, and how to be a compliant patient in that experience, and did not go over things that Justine said, or things like making informed choices or making choices about your own birth experience, whether it be pain medication or induction or whatnot, then I would strongly recommend seeking out another childbirth class, because even though I'm not saying the information that you learned is all bad, because there is something to be said about understanding the flow of that hospital or interventions that you might encounter, but a good quality childbirth education program, Jeanette and I often in our classes are talking about, how to make informed choices and how to speak to hospital providers to get information to make informed choices and what choices are out there and things like that. So I agree completely.
I had an interesting experience recently where I heard some feedback about something that I said in one of my classes, which was about a particular hospital's policy. And I also had spoken about a different policy at a different hospital because I teach people from different hospitals. So somehow someone at that hospital heard what I said, and it was a very simple policy. It was just a factual thing of, well, this hospital does this. But the patient apparently heard that and translated it to her care provider as that I was bashing that hospital, which was not the case. I literally was just, as even if I worked in the hospital, which I was hearing this from a friend who works in that hospital as a childbirth educator. And so we were talking about like, no, but that was the policy. I was just giving policy. Like I literally, if I worked at the hospital, I would have told you the same thing because that's the policy. But the difference was in having the conversation with my friend, the childbirth educator, about like, well, how would have you said it, you know? And she said, well, I'm not really confrontational, so I would say, well, you might want to just ask your nurse how they could facilitate this differently, right? And it was interesting to me because I was like, that's the difference. And when I used to work at that hospital, you know, it was the difference. It was awesome as a childbirth education department goes. It was very supportive about what we could say, evidence-based as well as just your opinion or your preferences. But if someone said, hey, I'm thinking of having a home birth, or I'm thinking about not doing this intervention, I could easily say, employed by the hospital, I was allowed to by the boss, like, oh, well, you can talk to your care provider about that, or go interview a midwife. Whereas I know other hospitals, they would say, you have to literally say like, oh, you want a home birth? You should talk to your OB about that. Like they have to push it right back. It's the diplomacy and what we're allowed to say that is the nuance sometimes. And that's the difference between what we all do as independent childbirth educators. We can be a lot more frank. And we can also sit back and realize, okay, so now whether you're a doula or have been a doula, we just know a lot of doulas, let's put it that way, because the three of us aren't super active, we're not active doulas. So we're talking to all our friends who are doulas and we're like, okay, what's happening over there? What's happening over there? Who are the people these days? Who are the good OBs that are more open to what some of our clients want? Who are the midwives that are really awesome too? Like, how do we navigate each hospital? How do we help our clients? And so we're hearing a lot more too about what the broader birth experience is in lots of places, so that we can then say, well, actually what's really interesting is that where you're giving birth, they don't allow that. Whereas 10 miles away at a different hospital, they do that all the time. And that's also really valuable. And I think that's where sometimes even our friends amongst the three of us talking today who teach in hospitals, and we know they're awesome childbirth educators, they still have some limitations on how they say things and what they can present because they're still employed by the hospital, even though they really try to walk the line sometimes. It's interesting to kind of observe that over time.
Mm-hmm. Yeah, I couldn't agree more. I think that there is a freedom in doing this privately, like this, being an independent educator means that we really do have the freedom, and that also comes with a lot of responsibility, right? We have to make sure that we are doing our own work, that we are really thinking about how are we presenting things, because we can also everyone has, as I said before, everyone has their biases around what birth they personally prefer, and so sometimes we can present things that make it seem, or that can make it extremely hard for somebody who, let's say they ended up choosing another option, another route. It makes it very hard for them not to come back to us feeling shame, right? So if we are presenting, this is the ideal birth, right? Very often for independent childbirth educators, it's low intervention, unmedicated vaginal birth, right? And if we're presenting that as the only way to have a good birth, then the person who then goes forward to have their own birth, and potentially, let's say they choose to have an epidural, they can come back to us, and when they're sharing that story, they're feeling shame, right? Or if a cesarean ended up being the safest route for them, then they can come back to us feeling shame around that. And so we also have to be extremely careful about how are we presenting the material that helps people understand that, like, I don't care how you give birth. I really don't, right? I don't care if you choose to have a cesarean. I don't care if you are looking to have an unmedicated birth. I will help you have both kinds of birth, and I will help you have amazing experiences that are right for you in those birth experiences. And that for me is really important. so that when people share their birth stories with me, they say, you know what, like I was intending to have an epidural birth, but when I got into it, I just felt so awesome and amazing, and I decided not to. And somebody else will be like, I was aiming for that unmedicated low intervention birth, but you know what, I ended up having to be induced and things because of this medical condition, and then that led to a whole series of other interventions. But you know what, I made really excellent choices. People really understood how I was feeling. I felt well supported, and I just feel like we got through a hard experience as well as we possibly could, and I'm so proud of us. Right? That's what I want people to feel. That's what I care about. It's not whether or not this was a high intervention birth or a low intervention birth. I really care. Did you feel powerful in your birth? Did you feel well supported? Right? If you felt those things, then that's an awesome birth experience. We can have low intervention births, and they can be extremely traumatic for people because they felt alone, because they felt unsupported, because they felt frightened.
Or they didn't have enough coping skills to get through the experience, right? So I know, I always kind of put it back on the patient because one of the hospitals that I teach at, I teach what we call natural childbirth and prepared childbirth. And even though I don't like that term, that's what people search for on the internet. So it's that's what it's called. And I fought for years that I've held firm to this, that anybody that teaches natural childbirth, their class has to include interventions and what to expect in the event that you need interventions, or what to expect in the event, what I call a reasoned epidural, right? In my natural childbirth class, I talk like, what are some reasons why someone who was originally very highly motivated to give birth without an epidural would make a different choice? Well, maybe your labor is longer and more difficult than you thought, or you had back labor, or you had an uncontrollable urge to push, or whatnot, right? It's very important to me, I know you do, Jeanette, to create that space for people to accept and still have a positive experience without shame if their actual birth was different than their intended birth. Mm-hmm. And there are lots of like, for example, natural childbirth classes out there, I'm using air quotes here, that they're like, well, these people are coming to me because they don't want any of that. They don't want a cesarean, so I'm not going to talk about that. But I literally had a patient once. I was working at this hospital, and she needed an emergent cesarean. It was a truly medically indicated emergent cesarean. And when we explained that to her, she burst into tears. And I gave her a big hug, and I said, we're here to keep you safe. My whole job in the operating room is to make sure everybody's doing their job. This is when I was working as a labor and delivery nurse. And what questions do you have? Like, things seem really crazy right now, but we're keeping you and your baby safe, and your baby's stable right now. I was assuming that she was afraid for the baby. And she was like, you don't understand. And she's like wiping her tears away. She's like, I skipped that part in the book. And I was like, I thought she was making a joke. Like, I skipped that part in the book. And I'm like, oh, but it's okay. Like, we're here. And she's like, no, you don't understand. I literally did not read that part in the book because I didn't want it to happen. And a good childbirth class is one that helps you, like you said, face those fears. If your fear is a cesarean birth, instead of just cutting that out and saying, well, we're just going to think positive, because I don't believe in positive thinking. But instead of just saying we're going to think positive, we are going to think positive, but we're also going to talk about how to face those fears. As Pam England in the book Birthing from Within, which I highly recommend, talks about your tigers. Like, what are your tigers? Your labor brain can't tell the difference between a real tiger and an imaginary tiger. So what are those tigers, so we can take care of them ahead of time and talk about it ahead of time, for sure. Yeah. So even in a quote natural childbirth class, we have to talk about all possibilities. We don't want anybody to feel like they have to be ashamed of making a different choice than they had thought of, because nobody knows what kind of labor the baby gods are going to give them, right? I certainly didn't expect a 36-hour back labor with an occiput transverse baby for my first experience. So it's very important.
Right. I mean, I was working with a client the other week, and She was coming to me for what I call birth support planning, where we work together to sort of co-create a birth support plan. It's not a birth plan. It's about, it's less about what are the, what do you want in your labor? Do you want an epidural or not? Do you want to, labor in the tub or not? Do you want the eye ointment or not, right? It's less about those things and more about what is the support that you need to get through this experience safely. And she was aiming for a unmedicated birth, and she was saying, I really don't want to fail at this. And I said to her, you know what, I can hear in just the way in which you're describing your situation and your desires, how strongly you really desire an unmedicated birth. And you know what that makes me think? That makes me think that if you were to choose an epidural, that you would be choosing an epidural for a really good reason. You would be choosing an epidural for a really good medical reason, or alternatively, a really good emotional reason, right? And I have complete faith and complete confidence in your capacity to make a really good choice, if that is something that you come to in your birth and you're like, okay, I didn't want this, but now I'm thinking maybe this is the path that I want to take. And so what I think about in terms of a good childbirth class is really giving people that power, right? That power to say, like, you know what, I can make good choices in my birth. And the choices that I might make are not the choices that I think that I might want right now, right? And that doesn't mean that that client of mine wouldn't necessarily be disappointed that she had an epidural, right? Like, we can't take away, all disappointment or all challenge, but we can help people reframe things away from failure, right? So, like, this is not a failure. This is an excellent choice, right? If because of how much she really wants to stay unmedicated, I just know that it would, if she chose it, she would be making a fantastic choice. And it's that, like, when you talk about positive thinking, that for me is positive thinking, right? It's not like, oh, we can't think about a cesarean, or we can't think about whether we might need an induction, or, we can't even consider those things. No, let's consider those things, and let's acknowledge how much we want them or don't want them, how much we're afraid of them. And then let's really sit with our own power in this and our own capacity to make good choices around our care, right? Like, if you don't want an induction and you are working really hard to avoid an induction, and then an induction becomes the route for you, I just know how much that choice is going to be the right choice for you, and how much power and strength it's going to take for you to make that choice. That's incredible. That's real. I mean, that's heroism right there, right? So I think that a good childbirth class also helps you to address, helps you to kind of tap into what is my own power, what are my own strengths, what is my own resilience, as we said at the beginning, and how can I use that moving forward into this experience. And then, the other thing I would say that is just so important when we're kind of thinking around kind of what a childbirth class can do, and this is something that, again, that I help my people do when I'm working with them, is to work out, what is it about me that I want other people to know, right? What is it about me that I want my provider to know, right? And how can I communicate that to them in a way that's going to be helpful, right? And that as well, right? Like, when we're feeling seen and understood, that matters. So maybe for some people, so I guess what I'm saying is communication. It's not just so childbirth classes help you to work out, like, how to communicate, what to communicate. This is things that you can't get off the internet, right? And so that information about yourself that you want to communicate can be different for everyone, right? Maybe it's that you lost your mother, and that's what's weighing on you as you move into this experience, right? This is why this emotional work is so important when we're thinking about preparing for birth. What are the emotions that are going on? Like, if you are mourning the loss of your mother, that matters.
Yeah.
That's going to matter. Like, maybe it's that you're afraid of needles. That's the most important thing that you really need your provider to know.
Yeah.
And you need that nurse who's super sensitive about needles, right? And people want to help. If you've communicated that and said that, I mean, Melissa, like, people want to help. Like, they're gonna like be more sensitive about needles.
I think the other thing to think about is, like, we've talked a lot about interventions and what you want and the emotional piece, but when it comes to a class, and when we were just talking, Justine, before we got on the call officially, one thing that I think was really interesting is that thinking about, as an individual who's expecting a baby or a partner to someone who's also expecting a baby, what is it that we're thriving, or I mean, not even thrive, well, thrive, what, no, what's the word?
Striving.
Striving for? What are we striving for? Do we want to make friends in a childbirth class? A lot of people want that. Do we want to have fun? Do we want this to be, do we want to be with an educator who's going to make us laugh and make us think and talk about the interventions? Or do we really want our partner, who might be, loving in many other ways and useful in many other ways, but they're not really good at massage and they certainly wouldn't know how to help me in labor? Do we want them to learn techniques so that the partner can feel empowered and know, oh, I know exactly how I'm going to try and touch her and check in with her and say, does this work? Does this feel better? Do you want this? Getting lots of practice with that. And there's some people who really want the mental preparation through something that's more like a hypnosis-based childbirth education program. And some people want to just stay at home and do a private Zoom call, or they could go to a class, but they don't want a group setting. They feel uncomfortable in a group. Or they want something that's less expensive and they'll do a lot of research on their own time. And it's just interesting. I don't think we usually think of it that way when we're pregnant. We just think, the hospital has classes, so why don't I go to that class? Or my friend Joe said that he and his wife took this class here and they had a good time, so I'll go there. But it may not be the best fit, and ultimately it might be the best fit. And especially the more I talk to you, if people could budget for more classes, I think there's some classes that are going to meet that part of your need. Once you're aware of what that class does, that's what you want to take, but then you want to pair it with what this other person teaches, and it's not just about breastfeeding, check, baby care, check, birth, check. Like, it's more about how is that stuff presented and by whom, and how is that educator the right person for you. Even if you're going to a hospital, the three of us know a lot of the same people, but like some of our friends that teach in a hospital, they tell me, well, not they tell me, but their clients will say, like, oh, I took a hospital class. And I'm like, oh, who is your educator? I know people over there. And they're like, I don't know. And I'm like, that's sad. Like, your educator should be such a personality, whether they're loud and funny while they're occasionally getting serious, or they're very more serious and really talking you through some deep emotional conversations. That should be important enough to you that you remember who they are. And if you can't remember their name, that could be an indication, especially if you're spending, hours and hours and hours with them. Yeah, it's just a thought that I had. Like, I wish people could pick and choose multiple classes from multiple educators so that they would get a piece of what each person's specialty is, so to speak.
Right. I mean, it would be absolutely amazing. I did actually take, when I was pregnant with my first, I took 2 childbirth classes. I took the hospital class and a private class. I took the hospital class because I wanted to see what the hospital how they were framing things. So I was extremely privileged and fortunate to be able to afford that. And I will say that I do not remember the name of the hospital educator, but I certainly know who my private childbirth educator was. And, I think you're right, like, really tapping into what do we want from a class. Like, I know that for sure my classes are designed to be, spaces in which we hold people's emotions, in which we explore the emotions of pregnancy, and in which the hard stuff gets talked about, right? So I spend time talking about anxiety and maternal mental health, and I've designed exercises around, really tapping into what is your power and resilience, but also like exploring, what are my fears, what am I worried about? And so, my class is really fantastic for people who have a lot of anxiety around birth, or who are looking for something that is really like a space in which you're getting a lot of emotional support. I know that other classes are, like, that's like not super, like that's not super like funny, right? I don't spend my time and my energy trying to be super funny. I'm not saying that I'm never funny. I'm just saying that that's not where I'm putting the emphasis of my class, right?
It's
And
probably
so,
not appropriate for you to, given the focus of your class, and that's okay. Every class can't be everything for every person. I think that's the interesting thing. Melissa and I are very much funny, and we're very hands-on, and we're trying to get people to, do positions and movements and use props, and interweaving your choices, and how can you talk to providers, and what would you like about this. But it's definitely, it sounds like it's a very different thing what you do, but I think many people would love and should want to take what you have as well and pair it with, have the both opportunities. Because I don't know that I'm the best person in a group setting to have the heavy conversations you're having. I can do it one-on-one if someone's staying late to ask a question, or they want to do a little private class to talk about that. We can do that. Not that I have your level of experience into the trauma piece. Of course, I would bring in, you need to see a therapist too. But it's really interesting too. And then how it presents as birth, like in the actual birth process. I was actually curious, Melissa, like, what have you seen for people giving birth who you feel like have explored the emotional side and their trauma or their fears, versus people who haven't? Like, what would you say, Melissa?
Oh yeah, I mean, I know you go through this too, Jeanette, when you talk. It's pretty standard. The fear, pain, tension cycle that Dr. Grantley Dick Reed first wrote about in his book Childbirth Without Fear basically is saying that when humans with our mammal monkey brains, because even though we're very sophisticated monkeys, we still have these mammal monkey brains, are in a state of fear, that causes tension in our bodies. And tension, decreases oxygen and increases adrenaline, and decreases oxytocin and endorphins, and causes more pain. And again, our mammal monkey brain can't tell the difference between a real wolf, right, or an imaginary wolf. An imaginary wolf being that I'm afraid of needles, or I'm afraid of a cesarean, or I'm afraid of getting an epidural, I'm afraid of not getting an epidural. And so if we don't take an opportunity in our pregnancy to really tackle those concerns, and I say this in class, I'm like, I'm not pretending that everything we talk about in class is going to be pleasant, right? We're going to talk about vaginal tearing, and that is not something that is pleasant to talk about. But for most people, when we normalize it, or we talk about ways that they can be proactive in preventing it, or practices that increase the risk or decrease the risk. And also, if you did have a tear, knowing that the vast majority of people are going to recover from that without any serious complication, and the stitches dissolve in 7 to 10 days, knowing that brings a lot of comfort to a lot of people, even though talking about tearing is not exactly a pleasant conversation. So people who have done that work ahead of time, tend to have less dysfunctional labors, or more functional labors. And it's not just hippy dippy mumbo jumbo. It's evolutionary biology, it's hormones, it's anatomy and physiology. People who have not done that emotional work, can bring those fears, those tigers, those wolves with them to labor, and it can increase adrenaline, which is known to block oxytocin. It bumps oxytocin off the receptor cells of the uterus, just like sticking gum in a key lock to slow and stop your labor, because your mammal monkey brain can't tell the difference between that real wolf. I don't want to give birth to this baby if there's a wolf around. It's gotta be a wolf snack, you know? And so I agree with you, Jeanette, that in our classes, we keep them fun. I always joke, this is not going to be your mom's Lamaze class. I might drop a couple F-bombs in here. We're all adult learners. We're going to have fun. I'm going to make you laugh. But I bring up that fear, pain, tension cycle because if people afterwards come to me and say, yeah, you brought up a few things for me and I have more questions about this, I have referred them to your class actually, or your website to have a private consultation, Justine, because I'm like, wow, these are really important questions, read Birthing from Within, but also like check out Justine, the website, because that my class is not the class that we're going to be able to delve into that stuff. So I know that your work, both in your group classes and your private sessions, also strive to not only help people face those fears, those tigers, maybe not reframe their trauma, but like talk about how their trauma could affect their experience, but they also strive to prevent trauma in the birth experience. Can you tell us a little bit more about that?
Yeah, sure. So we know from various studies that a good number of people who birth experience birth trauma, and the numbers are pretty high. But we also know that for the most part, it's not so much the emergencies that cause trauma, though of course there are times when emergencies do cause trauma. But it's not so much those that form the bulk of the birth trauma that we're seeing across the country. It's really the interpersonal experience between people and their healthcare team. So feeling dismissed, feeling belittled, experiencing racism, and also internal experiences. So the internal experience of feeling isolated, feeling alone, feeling as if nobody understands you, not having your voice matter. And so when we look at preventing birth trauma, it's really, there are kind of two kind of prongs to it that I think we can intervene in when we are childbirth educators. So one is enhancing communication, right? Whenever we can enhance communication between, or help our clients enhance their communication between themselves and their provider, and also themselves and their birth support team, their birth partner, then we are already kind of creating a protective layer around that person, right? If there's good communication, that really matters. And part of that is also helping people to know that they have options around who they birth with. And if it's not working for them right now in their pregnancy, they have the right to change providers. So that's one thing that we can really help support. The other thing that we can do is that internal piece, which is how can I make sure as much as possible that I feel supported in my birth experience, right? So what does that look like for me? What does safety look like for me? How do I feel safe, right? When I'm going through a distressing time, what are my normal coping skills? What do I go to, right? Are some of those useful for birth, maybe? Are some of them things that I really don't want to take into my birth experience? If I switch off, right? If I'm somebody who switches off when I'm going through something that is distressing, is that something that I want to do in my birth? And if not, then what help do I need to stay present in my experience, right? And so it's really working on these two things, like what is the support that I need to feel safe and seen and heard? And then also helping with making sure that people know how to communicate, know the importance of communication, understand that they have the right to be working with someone who is truly respectful of them as an individual and is giving them individualized attentive care rather than just, well, this is how we do it and it's my way or the highway, because while that might work for some people, if my way or the highway is aligned with what your goals are and what your hopes are for your birth, and that's how your birth goes. For some people, if there's a misalignment, then that in and of itself can cause trauma, even when your birth looks very straightforward. You have the birth that you planned for. So if you were planning for an epidural, you got your epidural, it worked. You then had your baby within a sort of normal length of a labor time, and both you and baby came out the other end healthy. If there's a misalignment with your team, that in terms of just the way in which they are interacting with you, then that can be a problem for trauma.
Yes, and that's why you work with professionals, so that they can know those things ahead of time, because you can tell patients or parents or families all this stuff, but if you're not also doing that other side, which is so good that you're doing that.
Yeah, absolutely. So there's only so much the parents can do, right? I mean, this is why when I got into the work that I'm doing, it was very important for me both to provide services to parents, but also do trainings for providers and professionals in trauma-informed care, because as you say, there's only so much that parents can do. And if the providers are not speaking to people respectfully, if they are not offering all the options, if they are not seeking true informed consent, if they're not okay with a refusal, right? If they punish people for a refusal, then that's not the responsibility of the parents to manage and to deal with. Really, it's the provider's responsibility to take ownership of the side that they bring to this experience, and to really and truly understand the importance of that interpersonal space, right? What happens in the interpersonal space between themselves and their patients.
Justine, you have an active Facebook group for all sorts of care providers in the birth world. Jeanette and I are both members of that group. I know that there's nurses and doulas and doctors and midwives and all other sorts of, perinatal professionals. What inspired you to create this group? And for those listening who work with families in the childbearing years, what do you think that they could gain from joining this group?
So I'm biased. I love my group. So
I also learn a lot in your group. I love it too.
So I love my group. I love my group partly because it is this interdisciplinary space, and I think that is so vital for thinking about trauma-informed care. Too often we are in our little silos, talking to each other within that little space, and we're not actually reaching out across the different professions and gaining understanding of what their experiences are, what their struggles are, not learning from them, from the way in which their good practices. And so by forming an interdisciplinary Facebook group, I love the capacity to really to nurture a community that is talking to each other rather than just talking to themselves. And so that I just think is super important. The other thing that is very important to me is that, so I'm a member of a number of doula communities, and I love doula communities, and I love doulas and think that they are amazing. But I also know that there isn't a lot of two-way communication between the doula community and the obstetric community. And so one of the things that I'm trying to do really, really hard is pull up like the healthcare team and the doulas, so that they can start talking to each other about their experiences and start thinking about how can we bring trauma-informed care into all of our practices. So
it can't just be the doulas, and it can't just be like the rogue nurses like me that go out above and beyond. to learn about trauma-informed care. I mean, this is something that surprises a lot of patients, that as a labor and delivery nurse, part of my orientation did not include labor support, bedside labor support, comfort measures to help you get through your labor and birth experience. My nursing education, my orientation did not include trauma-informed care, although I hope that that changes with great people like you, Justine, because there are other people doing this work too, not very many, unfortunately, but that are trying to train healthcare professionals, nurses and doctors and midwives in what trauma-informed care looks like, or what I have heard described, and I love this, universal precautions for trauma-informed care, meaning we wear gloves for everybody because we just assume everybody might have a bloodborne disease that I don't want to come in contact with. We don't necessarily need a disclosure that someone has a history of trauma to provide trauma-informed care, because A, it's sadly so pervasive, like so many people have a history of trauma, but B, it's great care for everybody to ask before you do, and obtain consent and explain what you're doing, you know. So you're not even a doula, which is even awesome, because I know a lot of childbirth educators are doulas. You came into childbirth at a different way. But it's awesome that we're bringing this space together where we can all learn from each other. We have so much to learn from each other. And too often there's like a hostility between doulas and providers. I mean, we've all seen things on Facebook where there are some providers that will say, you know, I won't work with you if you have a doula. And that's ridiculous on a number of reasons. But we have to talk to each other. We have so much to learn from each other. We have different scopes of practice, you know,
Exactly.
and different areas of expertise.
Yeah, and I want that OB in my group because I want them to learn from the community. Like, how are they ever going to learn if they don't have a space in which they can actually be welcomed and see these things, right? And so, like, if we can hold these conversations in ways that are real, that talk about the real trauma that is happening both to patients but also to doulas and to other professionals. I mean, like, labor and delivery nurses have extremely high rates of post-traumatic stress disorder. So, you know, we have to be having these conversations, and we have to be having them together, and we have to be welcoming in the people who are unsure, the people who don't know yet, the people who maybe they hadn't really thought about this before, and now through reading the material that we have in the group, that they kind of, some kind of light switch on through having respectful conversations. Now they're like, oh, okay, it's actually not that complicated. It really is just, you know, how I should be acting all the time. As you say, universal precautions is such a wonderful way of thinking about it, especially for providers who are used to putting their gloves on, right? Like, it makes sense, right? We need to be treating everyone as though they might have trauma, because we never know. Very few people actually disclose, right? Or even if somebody might consider somebody to have trauma, that person inside of themselves hasn't named it trauma.
Sure.
And so, but that doesn't mean that they're not getting the response. That doesn't mean that they're not needing the same level of care. So, I mean, I love the community. I think that it's so important to have these conversations. I do interviews with professionals. I also have a lot of mental health clinicians in the community who are working with the perinatal population. And so I do interviews, and I have different topics that we discuss. So, like, deep dives that I've done over the last few months that are organized by units. So we have a deep dive on vicarious trauma. We have a deep dive on the difference between dissociation, which is sort of spacing out and going somewhere else, and labor land, where you kind of move into that other part of your brain that is really facilitating your birth, but really isn't your prefrontal cortex, that front part of your brain that we're so used to operating in as human beings. And so I just think it's a wonderful resource for professionals, and it's so important that we're having these conversations, and it's so important that we're having these conversations in ways that is not just not just in the doula community, quite frankly. Like, it needs to move outside of that community, because doulas are not responsible for preventing trauma. They can only do so much in the birth room, and it has to be a team effort. And so that means that the obstetricians and midwives, and I love it because I can have in my community, I can have a high intervention, maternal fetal medicine doctor, right? Alongside a home birth midwife talking about trauma-informed care, right? Because they both need to be practicing it. And we need both of them in our maternity care system. There will be people who have the kind of pregnancies that really do need to see the doctors who specialize in really complicated pregnancies. And we need home birth midwives. And they both need to be thinking about trauma-informed care. And so that's one of the things that is just so special about this community, is how it can bring together people from across these different different disciplines within our system
Yeah.
to focus on the same thing.
It's funny. I love that you did this, and I'm part of some groups of lactation professionals who are also with some more like tongue tie specialists, so doctors and speech language pathologists, as well as airway specialists and ENTs, and that cross-disciplinary information is so valuable. And it just struck me too that I think most parents to be, they probably don't think about this, but they don't even realize how much extra some of us do to see and connect with each other so that we can do the best job that we can do for them, to provide them with resources and you go talk to this person, but also just informing ourselves as we're providing care as a care provider or as providing education and information to our clients, so that we can be better informed ourselves and keeping tabs all the time on what's going on in the industry, but not just our own little corner of the childbirth educator industry or the doula industry or the nursing, that kind of thing. So it's great that you had the forethought to put that together and try to make that group. So thank you for doing that. I want to ask one last question so we can close, because I know you've got kids waiting. So what are 3 quick tips that you would give to someone who has a trauma history as they're seeking out support and education for their upcoming birth?
Oh gosh, that's a fantastic question. So 3 quick tips. 1, choose your provider and your birth location well, right? You need somebody who is really going to look after you and support you and understand your unique needs and really honor the fact that you are an individual with individual needs. And so, you can do a lot of your own work just yourself, but if you're kind of coming into a system that is not going to support you, then it's going to be just so much harder for you to get through that birth in a way that is going to be joyful and powerful for you. So that's one. The other thing I would say is I would consider hiring a doula. I think that doulas provide really just fantastic additional support that it's even so much that I can't even we could spend an entire hour talking about how amazing doulas are, but really
we have done that. But I also want to interject. I agree. I know Melissa agrees too, but there is a doula at every price point, meaning there are some free doulas who are excellent. So if anybody just really can't afford to pay a doula, there are free doulas out there, and most people who are doulas or childbirth educators can help you connect with them so that can be possible. I don't want it to be only people with privilege can have a doula.
Mm-hmm.
It just, everybody deserves a doula no matter what.
Right. And what they can provide for you is they have a lot of knowledge about how to navigate the system. They have a lot of understanding about how to support you and your unique needs. So one of the things that can be so incredibly difficult for people who've experienced trauma is to find their voice. So one of the things that happens with trauma is that it shuts down the language part of our brain. And so when we are re-experiencing, it can actually, it can be just so incredibly difficult for us to speak. and to speak up and to articulate what's happening and what we need. And so having that extra support, having that extra person to help facilitate your voice, I think is just so incredibly important and powerful. And then I would say finally, so final tip for somebody who's experienced trauma. So work out, so sit down for some time, maybe with a journal. I mean, ideally, maybe you would find someone like me or someone else, maybe another childbirth educator, but somebody who could support you through this. But you can also kind of follow through on some of these questions on your own, just like with a journal. And so write down, the answers to a few questions. So one would be, what makes you feel safe, right? How would somebody recognize when I'm in distress? What does it look like in my body? And if I am in distress, what support helps me? So what does my partner do that is helpful to me? And alternatively, what do I wish somebody would do to help me? So I would answer the answers to that question. And then I would also ask the question, what parts of my internal voice do I want to quieten? And what part do I want to get louder? So I would sit down and I would journal with these questions for a bit. And then I would share these answers with my partner. So we can do this work internally, and that's wonderful. But in sharing with our partner, we have conversations about how we want to be supported in birth that is really helpful and really directive for the person who's going to be there with us. So for example, particularly that question around what does it look like when I'm in distress, and how do I want somebody to respond to that, right? That is just really fantastic information for somebody to then be able to recognize, you know what, you were doing okay, and now you're not. I can see that because we've had that conversation, and I have a plan to step in. I know what you want me to do at this point in time. And it's just an incredibly powerful thing. That's 3, but I have one more, which is on your birth plan. Please write down at the top of your birth plan, what is the information about you that you want your provider to know that is going to help that provider give you the best care that they can, right? This information doesn't have to be a disclosure of your trauma. It can be if you want them to know this, but it doesn't have to be a disclosure. But it can be something else. It can be, I'm super anxious about birth and I have a lot of fears, right? Whenever we're making connection with people who are helping us in this experience, they help us better. I mean, I think Melissa can probably talk about this, but like,
I was going to say, I say the same thing about birth plans. I feel like sometimes people think a birth plan is just, I don't want an IV, I want intermittent auscultation, I want my partner to be in the OR with me. And hopefully, as we've discussed 100 times so far on this podcast, that you are just like, we didn't prompt Justine. I want to make that very clear to everybody listening about her answers, but it's just so funny, Jeanette, isn't it? How like these keep coming up, right? Like you said, pick the place and the provider that's already going to give you what you want instead of trying to fight for it, and hire an advocate like a doula to help you find your voice. I mean, that comes up time and time and time again. But a birth plan is going to help the nursing staff I know, who are the ones that are providing the most bedside care to you. They are the ones that are by far spending the most one-on-one in-person time with you. More so than just like, I want this, I don't want that, telling me how I can best meet your needs. Do you want me, I'll give an example I give in class. If you're getting a medical procedure, do you want me to tell you everything that's going on because you want to know step by step? Or do you want me to talk about baking brownies and how good they smell and how good they taste, or a funny joke about my kids, right? Like, do you want me to distract you, or do you want me to tell you step by step everything that's happening? That is going to be more impactful to your care in really big ways than just saying like, I'll accept an IV if I'm dehydrated. Like, I mean, I feel like that is important, but the biggest stuff at the top is what Justine's talking about. What are ways that we can help you feel emotionally and physically supported in this experience? That's absolutely, what are your worries and fears? How can we alleviate them? How do you, how can we best be there? Be there for you. So.
Exactly. I mean, like, this is what I do, like with people, it's a birth support plan, right? Like, so think about your birth plan as a birth support plan. What do you need? What help do you need to feel supported no matter how your birth goes, right? So let's say you're somebody who doesn't want an IV and you only accept an IV if you happen to be really dehydrated, right? That's wonderful for you to know about yourself. That's important information and to gain that. But quite frankly, your labor and delivery nurse does not need to know that information in a birth plan, right? Because the decision to have an IV or not have an IV will happen in the interaction with that nurse in the moment. And
that's true. Absolutely.
Right?
Yeah.
What matters is exactly what Melissa's talking about. Are you somebody who wants to be talked through procedures, or are you somebody who wants to be distracted? Are you somebody who has a very intense fear of strangers, and everybody who comes into the room needs to introduce themselves to you very clearly and tell you why they're there and knock first, right? Are you somebody who doesn't like to be touched, and so really needs, when touch is necessary, really needs a lot of gentleness and consent seeking around that, right?
That's a great one, Justine, because I feel like I see on birth plans a lot, I only want a vaginal exam if medically necessary. And what that says to a provider who isn't trauma informed is, well, yeah, we only do them when I think they're necessary, right? And that's not usually what people are going for. Like, yes, there is plenty of evidence that says a vaginal exam, multiple vaginal exams increase your risk of infection in labor, right? But for many people, and we don't know that, but for many people, when they put that down, they're actually saying like, vaginal exams are painful for me. And I really don't want one unless it's absolutely going to tell me something about my labor or birth. And so instead of putting, I only want a vaginal exam if medically necessary, something like, I have an extreme fear of vaginal exams, and I would love the opportunity to empty my bladder and talk it through, because this is something that is pretty painful for me. I feel like even the most grumpy of nurse or provider is gonna like, oh, okay, like take that differently than I only want it when medically necessary. I think that gives everybody pause. Like, oh wow, she's telling me like this is something that she has a big fear about. Oh, maybe I should take a moment and explain it to her.
Right, and I think sorry, I was going to say that what you've said is so interesting, because one of the things that I teach people to do is to articulate how they feel about something, what they need, and then to make a request. So, and you just did that in your example. So I have a real fear of vaginal exams. That's my feeling, right? I need to have a conversation around them before they happen, and I really need them to be done incredibly sensitively and gently, right? And then a request: would you be willing to take some time before a vaginal exam to kind of go through with me why this is necessary at this point in my labor?
I love it. I think that, like I said, even staff that is kind of just trying to get things done for the day is gonna hear that or read that, and it's gonna have more of an impact than just, I don't want a vaginal exam unless medically necessary. Like, thank you for putting the words to what was in my brain, right? Like telling people, tell us how you feel and what you need. I think that's a great ending to this, like, I learned something every time we do this podcast, Jeanette.
Yep. Yep.
In fact, I'm going to start telling myself, because Justine gave me this idea, to tell myself, what part of my inner voice do I want to quiet today?
Yeah.
And what part do I want to make louder? I love that, Justine. I'm taking that away from this for sure. Thank you for being with us today.
Yeah, absolutely.
It's been wonderful.
I have a whole other one on birth plans too, because that's like such a debated topic of whether they're even useful.
Yeah.
The way that you're presenting it adds a lot more use for the birth plan for both the parents and the providers too. So
yeah, I mean, I do think that I honestly think that they're useful, and I think that they are underutilized, like even when they're used.
sure, yeah.
So
There's research on
so
that.
much more that could be done with them to communicate what you need and what kind of care will help you feel safe and seen and heard.
Awesome. Well, thank you. We should probably let you go. You've got like a little, we all have kids to take care of today. But thank you so much for being our guest today and sharing all your knowledge. And I hope we can collaborate on some projects. I've got some ideas. So if you want to learn more about the services and classes that Justine offers, you can learn more on resilientbirth.com. And if you're a care provider, you can look for the Trauma Informed Perinatal Professionals group on Facebook and ask to join. We hope you will continue watching our video casts or listening to them as a podcast. We've got more guests coming up, and those will be announced on our website. And over to you, Melissa, for the next bit.
Yeah, so if you learned even one tiny crumb of information you couldn't possibly have not today, this was a fantastic episode. Please don't be stingy and text a friend who's either expecting or parenting and tell them about this podcast and this video cast, and consider, watching past episodes or listening to past episodes if you're just joining us for the first time. And as always, if you want to laugh your stretch pants off while learning about childbirth, babies, and breastfeeding, please consider taking a live and interactive Zoom class with us at Babies in Common, and tell your friends. Virtual feeding consultations and a weekly feeding group called Breast Milk and Conversation are also available virtually. And if you follow us on social media, follow Babies in Common. We are always posting great articles, videos, and resources to help you rock your birth and thrive as a new parent.
Our next episode is coming up on Wednesday, May 27th at 5:30. We'll be discussing the postpartum visiting nurse appointment with some friends of Melissa. And now Melissa herself is a postpartum visiting nurse as well.
That's true.
Finding out what happens in that visit, what do these people do, why should we want to have a postpartum nurse visit or 2 or 3, and how you can maximize the value that those care providers provide in your home. But we hope you'll join us for that, because we are a community for you. And after all, we all have, as we always say, we have babies in common.
Babies in common. Thanks, Justine. Have a great afternoon.
Thank you.